Hello, my name is Beverly Tuomala, and I'm a certified heart failure nurse specialist. And today I'm going to talk to you about living with heart failure, the sodium fluid restriction. Heart failure and sodium restriction go hand in hand. So every patient that has a diagnosis of heart failure should be instructed about sodium restriction in their diet, because the kidneys can no longer regulate salt and water, and they want to hold on to it. They're kind of fooled or tricked into thinking they need to hold on to salt and water. So the patients must be able to regulate this or monitor this on their own. And this is a problem because the average American takes in between 4,000 and 10,000 milligrams of sodium per day. We want our heart failure patients to only take in about 2,000 milligrams a day. And that sounds easy, but it's a challenge. Compliance is very difficult. The elderly patient likes to use salt to enhance the taste, because we all know as we get older, the taste buds kind of lose their effectiveness, and so our patients like to add salt to make their food taste better. We like convenience. We like it fast. We want it to taste good, and we want it to be cheap. So the foods that we tend to choose, your frozen foods, your fast foods, they're convenient. They taste good, but they're laden with salt. And it's also a very difficult concept for them to understand, because we'll tell them you're allowed 2,000 milligrams. Well, they think, well, I won't add 2,000 milligrams. I'll just eat the food that's there. I won't put salt on my food. But that's not enough. Teaching is paramount. We have to teach these patients about the sodium restriction. We have to reinforce the teaching and then reinforce it again. At every visit, every time I encountered a patient, I would ask them, how's the sodium restriction? What do you find hard about it? What is easy about it? Involve the family when you can. The person doing the cooking, the person doing the shopping. If it's not there, they can't eat it. So hints to lowering sodium in the diet when they're cooking. We tell our patients, don't cook with salt and don't add salt at the table. So if they don't cook with salt and they have a family that they're eating with, the other family members can add salt if they need it. But we need to really teach these patients not to add salt, and eventually their taste will become accustomed to it. Eat fresh or frozen vegetables is an easy way. Neither one have a lot of salt. Frozen vegetables are great because they can be stored and won't go bad. We teach them to season their food with either fresh or dried herbs, vegetables like a saute of celery or peppers, onion put on top of their food, or use the no-salt seasonings like Mrs. Dash. We also had talked about earlier the sodium substitutes that we use, the salt substitutes. But remember, those are high in potassium, so sometimes we have to be careful. When our patients eat out, things I like to tell them are order foods that are cooked without breading, without butter or sauces. Maybe get it on the side. You can dip it in just to get that added flavor. Ask that no salt be added to your food. And don't eat soup. Never eat soup. Soup is laden with salt, and that's why it tastes so good. So they need to really make their soups at home and not add salt to them. Salad dressings are also loaded with salt. So again, get the salad dressing on the side and dip the salad in the dressing. And don't eat at restaurants that have caused a weight gain the following day. So if they've gone to eat Italian food or Mexican food, if they find that the following day they have bloated or swelled up and their weight has gone up, they probably shouldn't eat at that restaurant. Encourage patients to keep track of their sodium every day. And that's hard. So probably the best advice I could give you is I have my patients keep a log for like 3 days, just as we start teaching, and just say, write down everything you eat, and then let's figure out how many milligrams of sodium is in each thing that you eat. So teach them how to read a food label. They need to know, when I turn it over and look at the food label, I need to know how many milligrams of sodium is in this item. Like a hot dog. A hot dog link is about 480 milligrams. And so the serving size is 1 link. They're eating 480 milligrams. So that's about a quarter of what they're supposed to have for the day. And then you add on the bun, and you add the mustard and the ketchup. And God forbid they use relish, which is high in salt because it's pickles. So, a hot dog, just one simple hot dog, can easily put them over their daily limit, or at least halfway. So make sure that they understand serving sizes and how much of something they can eat, so that when they go shopping, they can look and they can make educated choices. Have them buy products that are labeled low sodium or sodium free or very low sodium. Typically, this has about 140 milligrams or less of sodium per serving. So these are pretty safe, and these are things that we'd want them to buy. We know that studies have shown that 75 to 80% of our daily sodium intake comes from processed or restaurant foods. So that's where the salt is. It's not in the shaker. It's in the foods that we're already eating. And almost all fast foods are high in sodium. And a great example of this is Jared on the Subway commercials. I'd say, you know, Jared's gotten lean and he looks good on Subway, but he's eating a lot of salt. And our patients are very surprised when they find out how much salt is actually in, you know, their Subway sandwich. So our high sodium foods are basically any cured meat, like bacon, corned beef, your processed meats like ham and lunch meat, all types of sausage, hot dogs. Rotisserie chicken is another one, and we don't think of rotisserie chicken, but it's injected with a salt solution that enhances the flavor. Anything in the can, pretty much. Your vegetables will be salted, tomato sauce, your soup, tomato and vegetable juice, you know, V8 juice, loaded with salt. Your olives and pickles, and even your light salt, your sea salt. This question comes to me a lot. Well, I know I can't use salt, but is sea salt okay? And my answer to that is salt is salt. So it's typically might have a little bit less milligrams of sodium, but it still has quite a bit. And another surprising one is lemon pepper. Have them look at the label, because some lemon pepper has salt in it. Examples of sodium content, just so you kind of have an idea. A 3-ounce slice of ham has over 1,000 milligrams of salt. Look at the beef pot pie. Remember we ate those as kids? 1,300 milligrams of salt. A Burger King Whopper with cheese, 1,177 milligrams. Just a little tiny hamburger from McDonald's has 500 milligrams of salt. And sadly enough, the Pizza Hut pepperoni pizza, 2 slices of medium pizza, is 1,100 milligrams of salt. So you can see that it adds up. And so if you're eating 1,000 to 1,500 milligrams of salt in a meal, you have 500 milligrams left for the day. So patients need to be aware of this, and they need to know how to make food choices so they don't get into a bind. And I always tell them too, whatever you don't eat today, you can't roll over for tomorrow. Not allowed. Your low sodium foods are all of your fresh and frozen vegetables. Lean beef, pork, chicken, turkey, anything that's not processed in a salt solution. Fish that's fresh or frozen and not breaded. Pita bread, taco shells, even corn tortillas. Now your flour tortillas have a lot of salt, but your corn tortillas are fine. Popcorn, unless it's the Orville Redenbacher salted with butter that we put in the microwave. But air-popped popcorn is a great snack that doesn't have a lot of salt. And then, of course, pasta and rice. So when my patients ask, well, what can I eat? You know, well, stay away from the convenience foods and let's go back to the basics. Buy meat, cook it, you know, buy your pasta, your rice, potatoes. If you don't put salt on it, it doesn't have a lot of salt on it. So let's just look at some sodium-safe foods and how much salt is in them. 3 ounces of beef, 55 milligrams. Cheese, mozzarella, 106 milligrams. Your cheddar cheeses, I think your ricotta cheese, they do have tend to have a lot. So just have them look at the label. Milk is a great source to drink. It doesn't have a lot of salt in it. And look at your cooked rice, only 4 milligrams of salt. So there are foods that they could eat and not increase their sodium intake. Sodium restriction, here's some resources that I've pulled for you. Living with Less Salt is a dietary guide. And basically it's just a small pamphlet that just has anything you can imagine that you would eat and how much salt is in it. Another great resource is www.acaloriecounter.com. And that's where, like, all your fast foods will be listed. You know, how much is in Arby's sandwich? How much is in the McRib that's out right now that's real popular? The American Heart Association has a great resource for how to lower sodium in the diet, how much sodium is in things. They can even take a sodium pledge on that website. The last thing I want to talk about for resources is the National Salt Reduction Initiative. And this was started about 2008. And basically, we realized that there's a big problem in our food industry. They add a lot of salt to our foods. So some companies have jumped on board and they pledged to reduce the amount of sodium in their foods by 2014, 2015. So there's a few companies that have done that already, like Kraft. Their little cheese packets, the cheese slices are lower in salt. Ragu spaghetti sauce has a lower sodium content. And even the Subway sandwiches have decreased their sodium content. So industry is getting on board, but we've got a long way to go. But our Food and Drug Administration has recognized that sodium is a big problem in our country. It's the leading cause of high blood pressure in our patients. You know, they're eating a lot of salt, and we're putting them on medicines, but if we could just lower their sodium intake, blood pressures would soon follow. So what are the benefits when we restrict salt for anybody, whether they have heart failure or not? We'll reduce fluid retention. Our patients will require lower doses of diuretics. We'll reduce the need for sodium in their food by taste. So over time, they become accustomed to the lower level of salt in their food, and it tastes better. They actually taste the food and not the salt. And then they can share that health benefit with their family, because everybody benefits with a lower sodium in their diet. So just to kind of go further from sodium restriction, we'll talk about fluid restriction a little bit. Patients with heart failure need to reduce their daily fluid intake. Again, the thirst mechanism is huge in these people. They're thirsty, and they will drink and drink and drink. So we typically have to restrict their fluid intake to 2 liters per day, and that's roughly about 64 ounces. We even have to educate them on foods that are high in fluid. Our high fluid content foods are things like popsicles, watermelon, yogurt, ice cream. You know, they have to kind of account those things in their 64 ounces that they take in a day. So we've talked about thirst, and thirst is real common in these people. There's that mechanism in the brain that causes them to feel thirsty all of the time. So we tell them to use hard candy or chew gum to lessen that need for drinking. And patients don't get the concept. They think if they're urinating a lot, they're losing a lot of fluid, they want to replace all of the liquids that they're losing and replace it by drinking more water. And we exactly don't want them to do that, because we're losing the benefit from the diuretic. So we want them to limit their fluids to around 2 liters or 64 ounces a day. And this is especially important in those patients who are on a lot of diuretic. Those that I've had on 80 milligrams twice a day, or even 160 milligrams twice a day of Lasix. Those people had to be on a fluid restriction, because I can't increase the water pills much more than that. And if their kidney numbers are starting to climb, I can't increase the water pills, so they need to really monitor their fluid intake. And then we also do this in the hospital, and immediate post-discharge, keep them on a fluid restriction. As diuretic needs drop, and patients aren't retaining water a lot, sometimes we can lift this restriction. So you'll see it come and go in some of your patients. So in summary, and kind of an overview of what we've talked about as far as sodium and fluid restriction, sodium restriction is a must for most heart failure patients. And it needs to be taught, and it needs to be retaught to these people. They need to limit their sodium intake to 2,000 milligrams a day or less. Most sodium comes from convenience and processed foods, so have them avoid those type of things. Fresh is best. Compliance is hard. These foods don't taste as good. They're not as easy. You know, you can't run to Taco Bell and get something low sodium, or you can't run to Burger King and get something low sodium. So they need to know what they can eat, how to make better food choices. And some patients need to limit their fluid intake to 2 liters a day or 64 ounces, especially those who are just out of the hospital after an exacerbation, or those patients who are on high doses of diuretic. All right, that concludes the sodium fluid restriction for this module. You can send questions to me at btuomala@hcpoftexas.com.